A child under the age of 10 became Connecticut's first case of measles since 2021. When addressing the issue, the Connecticut Department of Public Health Commissioner has one clear message: make sure your children are vaccinated.
Vaccination is the #1 way that we can prevent measles. One shot against measles is 93% effective. 2 shots, which is what we recommend, is 97% effective.
According to Commissioner Dr. Manisha Jitani, Connecticut maintains a 98.2% vaccination rate among kindergartners. She says the child who contracted measles hadn't been vaccinated and now adds to a worrying trend of measles nationwide.
In the United States of America, 2025 is likely to be the hallmark year where we lost our elimination status of measles. That has not been declared yet by the CDC, but it seems that's the direction that we're going in.
Nationwide, the CDC says just under 2,000 cases of measles have been reported in 2025, the highest number of reported cases since the disease was declared eliminated back in 2000. Dr. Jitani says Connecticut was one of just 8 states without having reported a case.
Sometimes people forget the impact of a disease, and we've had 25 years of small outbreaks here and there, but they were able to be quashed in their place. What we've seen this year is more sustained transmission around the country, around other countries where people have gone to, particularly our neighbors, Canada and Mexico, but internationally beyond that as well.
We've since learned the child who contracted measles traveled outside of the country, and when they returned, started experiencing symptoms including coughs, runny nose, congestion, and a fever. Dr. Jitani says the Department of Health is investigating who the child came in contact with after they came back home and will notify those people when they can.
If there was somebody with measles in a room, those particles are in the air for up to 2 hours. The way to protect yourself against measles if you're not vaccinated is with an N95 mask. It's thinking back to the days of COVID. People know about how these types of viruses, particularly one as infectious as measles, which is far more infectious than COVID.
Dr. Jitani couldn't go into specifics about the gender of the child, what country they traveled to, or their current condition. She says that those who are vaccinated for measles who do contract the disease may not even know they have measles because it will be a much milder case. Now, even though this is the first case of measles since 2021, Dr. Jitani says that she doesn't believe there's cause for concern for anyone else in the state. In West Hartford, Jamel Johnson, Fox 61.